We are back, and we're talking about babies, and we're talking about moms, and we're talking a little bit about how to manage the discomfort, the anxiety, the stress, the pain of having a baby.
Right.
And we were talking about nitrous oxide.
Yes.
Again, are there other options, or maybe just a more broad spectrum question? What are the options that are available for moms today?
Right, so the first part of our conversation was focused on the nitrous. I briefly mentioned the IV pain medicine.
Yes.
But traditional kind of the be-all, end-all is what we call regional anesthesia. That's the epidural. So that is still very much present, still used widely. Actually, if a patient has used the nitrous and realized, no, this isn't really working for me, she can easily transition.
So there's
to the
adjunct
epidural.
things or combination things you can do
Correct,
today.
correct.
When you talk about IV medication, what does that do? Is that more sedating? Or?
It definitely helps on the pain fibers, but it is even more sedating than the nitrous because it's longer lasting.
Got it.
Epidural we call it regional anesthesia because it creates a numbness from about the waist down, but it is not sedating. And so we here at Coastal Carolina Hospital have anesthesia here with us 24 hours a day, 7 days a week. So they're always available for whenever a patient recognizes that she is at that level of wanting to move further.
I think it's really interesting. I have 10 grandchildren, and I've been fortunate to be there when the kids have been born. And it's funny how we all think as prospective moms how we want to deliver our child.
Correct.
But what I hear you say is, it's okay to just let things unfold.
Correct. We try to get patients to arrive with goals, but not to make them concrete. Expectations, but to give their body the grace and the ability to change, and their mind to change as labor progresses.
What do you encourage? Is it still you encourage dads to be there to coach, moms to really educate themselves about the process and what to expect?
Yes, absolutely. We try to keep dads as involved as possible. A lot of our pregnant women are starting to bring doulas with them to the hospital, which is almost like their extra support person or coach. So whatever makes the patient most comfortable, our expectation is that they're present.
So again, if it's my first child, that's one thing. Do you find that women who are having additional children kind of shift in the way that they approach childbearing and maybe are a little more open to other options for discomfort and pain?
I don't even know if it makes a difference whether it's first baby or having had children before. I think all patients come in, especially with the nitrous oxide being new. All patients are interested in wanting to try it, and they all can. There's no person who's not a candidate.
Got it.
But I think that flexibility is really all patients, whether it's their first baby or not.
What is the protocol now for how long do folks stay in the hospital after having a baby?
Yeah, so
now I get to ask the fun stuff.
Yeah, it's gotten a little quicker. So after a vaginal delivery, it's anywhere from 24 to 48 hours. And after a cesarean section is anywhere from 48 to 72 hours.
It's really funny. I don't even know if you remember telling me this, but I remember you telling me that having a baby and being pregnant isn't a disease or a disorder.
That's right.
It's something that's very natural and very normal. And since you have said that, it's just funny how looking through that lens is really, it's really impactful.
Yep. It's a very exciting time in a woman's life, and a lot of things happen, a lot of change occurs. But no, we don't treat it as if it is a disease, because it is just one of those facets of life. Things happen quickly, but thankfully things get back to normal quickly too.
Dr. TD, as we all know and love her, is excellent and well-versed in many, many subjects. I'd love to have you come back on again, talk hormones. There's just so many things you could talk about that I think are fascinating for all of us. You make them user-friendly, so it's great to be able to talk to someone and ask the questions and get an answer that we all really can understand. So thank you for your time today.
Thank you.
Stay with us, there's a lot more to come here at Coastal Carolina Hospital. Talk to you in a few minutes.